So we have already discussed about the body of the maxilla, and this is the anterior surface, this is the posterior surface, and this is the medial surface, frontal process, zygomatic process, alveolar process, and the palatine process. So now we'll discuss about the medial surface of the maxilla. So here on the medial surface you can see a big hiatus. This is known as the maxillary hiatus. This is the opening of the maxillary air sinus which is present in the body of the maxilla. And this medial surface is also known as the nasal surface because it forms the lateral surface of the lateral wall of the nasal cavity. And here you can see this is the ethmoidal crest. This is the frontal process, and this is the ethmoidal crest through which the middle nasal concha of the ethmoid is attached over here, and you can see the conchal crest through which inferior nasal concha attached over here, and this is the nasolacrimal groove, and it is covered with the lacrimal bone. So it becomes a nasolacrimal canal which contains nasolacrimal duct which opens into the inferior meatus, and this is the maxillary hiatus. This is a big opening of the maxillary sinus. It is covered with the number of bones, and then it becomes a smaller opening of maxillary air sinus. Posteriorly you can see there is a one more groove which is greater palatine groove. This greater palatine groove is covered with the vertical plate of the, this is the palatine bone, and this is the vertical plate of the palatine bone. It is covered with this, and it forms a greater palatine canal through which greater palatine vessels passes. Fine. Now the covering of this maxillary hiatus, we start anteriorly by the lacrimal bone, superiorly by the labyrinth of the ethmoidal bone and the uncinate process and bulla ethmoidalis of the ethmoidal bone, posteriorly and inferiorly by the vertical process or perpendicular plate of the palatine bone. Inferiorly there is a inferior nasal concha which is attached to the conchal crest. So this opening becomes very smaller, and it opens into the middle meatus, that is the lateral wall of the nasal cavity. Opening of maxillary air sinus is higher than the floor of the maxillary sinus. So maxillary sinusitis is very common. And now if you come to the processes, this is the frontal process. Frontal process of maxilla. Anteriorly it is as notch, anterior nasal notch, and this frontal process is attached to the, I will show you in this, attached to the nasal bone and the frontal bone. So this is the frontal process of maxilla attached to the nasal bone and the frontal bone. So this is the nasal bone. If you want to see, this is the left nasal bone. Now there is a lacrimal, anterior lacrimal crest through which the lacrimal bone is attached, and this groove is covered with the lacrimal bone. Then this is the zygomatic process. This zygomatic process is attached to the zygomatic bone. So you can see this is the zygomatic bone. This is the maxillary process of zygomatic bone which is attached to the zygomatic process of maxilla. Now you can see the alveolar process. This is the teeth bearing area, that is the maxillary teeth are there, and maxillary teeth are supplied by the branches of maxillary nerve. And again the three molar, you can see there is a horizontal line for the origin of the Buccinator muscle. And posteriorly there is a maxillary tuberosity. There is a maxillary tuberosity, and there is a attachment of the pyramidal process of the palatine bone. So these two areas for the origin of the superficial head of the medial pterygoid muscle, which is a muscle of mastication. Superficial head of the medial pterygoid muscle and the buccinator. So two important muscles they take origin from the maxilla. There are number of the muscle of the face, they also take origin, but important is this. Now this is the palatine process of maxilla. It is a self-like horizontal projection from the medial surface, and this palatine process attached to the other palatine process of the maxilla, and it forms the intermaxillary suture, and it forms the anterior 2/3 of the hard palate. Here you can see there is a incisive canal. This incisive groove, when it is attached to the other bone, it becomes the canal, and I will show you through this. So this is the incisive foramen, through which nasopalatine nerve from the nasal cavity comes out, and the greater palatine vessel through it passes, enter the nasal cavity. Here you can see this is the horizontal plate of the palatine bone, which form the posterior 1/3 part, and the greater palatine foramina, and these two lesser palatine foramina. So the greater palatine, lesser palatine nerve vessel passes. So this is the horizontal plate, this is the perpendicular plate, like this. Fine. And this palatine process, superiorly it forms the floor of the nasal cavity, and inferiorly it forms the roof of the oral cavity. And you can see there is a nasal crest, the raised area, this is known as the nasal crest, through which vomer bone attached, which form the nasal septum. So I will show you in this diagram. Here you can see this is the vomer bone, and it is attached to the nasal crest of the palatine process, and it forms the medial wall of the nasal cavity or the nasal septum. So this is the vomer. Fine. Now regarding the age changes of the maxilla in the children or in the infants, the body of the maxilla is anteroposteriorly and transversely more than its length, or in vertical direction. Fine. And the maxillary sinus is not developed or very minimal, and because these sockets are alveolar process is not developed. Fine. And in adult, this alveolar process is well developed, teeth sockets are there, well developed, body is well developed, maxillary sinus is properly developed, so it is vertically more than the anteroposteriorly and transversely. In old persons, because there is the teeth they fall and there is a bone resorption, so again there is less vertically and more in the transverse and the anterior posterior direction. So it reverts to the infantile condition, you can say. Thank you.